Hello everyone, today I'm going to be telling you about my case study, specifically over a female patient who is 22 years of age and is suffering from a complete ACL tear. For the purpose of this, to keep confidentiality, we will use the initials BK when referencing the patient. So the symptoms for a complete ACL tear would be rapid swelling, severe pain, issues with weight bearing, balance issues, and loss of range of motion, or ROM. And the treatment for a complete ACL tear would be in phases. And so phase one would entail essentially reducing the swelling and the pain and then getting some of that ROM back, because the further along you get in the stages of this treatment process, range of motion becomes crucial because you want to be able to use this ligament as you were using it before, or at least get somewhere where you were close to where you were before. So range of motion and the reduction of swelling and pain in this first phase would be crucial. Phase two would be to reach the full range of motion goal. And the patient can be doing like closed circuit exercises that pushes them, but doesn't necessarily make them so uncomfortable that they can't continue the exercise. It's very much a baby step sort of process when you have a complete ACL tear. This is also the phase where the patient should start to wean off the crutches a little bit and maybe become less reliant on the crutches, because again, range of motion is something that is very important in this process, and you can't necessarily do that if you're on crutches. Phase three, which is where the patient BK is currently in this case study, this is the phase for strength and resistance training. So the patient should be able to do light functional movements, things like lunges and maybe squats, in order to, again, test their range of motion, but also get them doing functional movements that athletes do, because this is a common sports injury. This phase should also contain some resistance training, and it also should incorporate some form of regaining balance. Because if you remember, some of the symptoms are issues with weight bearing, which is there's balance issues as well. Phase four would be advanced strength training and agility, and the patient should at this point be engaging in drills. There's jumping mechanics that are involved, and then they begin to work on their running progression to slowly get them back incorporated into sports. So phase four is a pretty hefty phase where the ball kind of starts rolling pretty quickly. Phase five is essentially the end. You have to be able to pass a return to sports test, and it's just a test that makes sure that you have successfully completed all the stages, but also that you won't be backtracking when you are finished with your treatment. It's also if the patient feels that they should be able to return to sports, they should pass the test, but also there's an emphasis on avoiding re-injury in this phase, because obviously somebody doesn't want to have multiple complete ACL tears back to back. So it's a lot of preventative movements. So how this patient in this case study is specifically doing, BK, she is in phase three right now. She has a great attitude about her recovery. She's now able to do a little bit more functional movements, and so I think that was a big motivator. They are consistently doing some strength exercises at the moment to rebuild all the things that they have lost, a great range of motion, and they've begun to slightly and lightly jog for like short periods of time, but that's a huge step. And at this point in time, there are no modifications that need to be made to BK's treatment plan, because she is on the right track, doing all the right movements, and has the right attitude. Physical therapy can help this patient restore their movement and flexibility, retrain their functional movements, and improve their balance and coordination. Essentially, physical therapy can help this patient return to sports. And like I mentioned earlier, have preventative strategies to not get re-injured. Yeah, thank you very much.